Good evening. Welcome to Ask Me Anything with Dr. Twyman. I'm back from my trip to Orlando. Went to the Silverback Summit this weekend with my team from Apollo Cardiology. We had a Apollo South, as we were calling it. So, quick sun run to Orlando for the Silverback conference. We were there to screen people for their vascular health, but I was there as well as a speaker to discuss my take on the Traverse trial. So, for those that haven't heard of the Traverse trial, came back in 2023 and was looking at men who were high risk for cardiovascular disease or known cardiovascular disease who were placed on testosterone replacement therapy. It's a complicated study to discuss quickly on Instagram, but the take home is that there was no increased risk of cardiovascular events in patients on testosterone replacement therapy. Lots of caveats. It was using topical testosterone, where most people use injections or pellets. It was dosing at relatively low doses, and there's a high dropout rate from the trial, meaning 60% of people didn't take the drug for the prolonged period of time that the study was being put on for. Supposed to go for 5 years, stopped after 2 years. So a lot of caveats for this study, but the take home was that testosterone at that dose was not high risk for patients with cardiovascular disease. So that's what I discussed at the Silverback Summit. Got to see some old friends, got to see people who helped me build Apollo Cardiology. So good times there. Back to town and seeing patients telemedicine from all over the country today. So the Skool community is starting to grow. That's where I do more teaching. We'll have a monthly Ask Me Anything where we're doing more in-depth back and forth questions about people's individual care. I have notes from my prior conferences when I was at the Mayo Clinic conference that talked about AI and cardiology. My notes are in there. I have some notes from this Silverback Summit. So notes on testosterone replacement therapy in men with cardiovascular disease from my talk. I have notes on different ways to think about anxiety and stress affecting hormones. So if you're interested in those kind of notes, it's in the Skool community. That's just drtwyman.com/school, or if you go to school.com/drtwyman, it'll get you to the same place. So with that housekeeping underway, we'll jump into the questions for the night. So somebody put in a stem, but I don't think they have the second part, so I don't know exactly what they were diagnosed with. So whoever put the question in there, I have been diagnosed with this after a coronary angiogram. Any advice? I don't know what you were diagnosed with. I suspect it's microvascular disease, meaning they did not find any significant coronary obstruction in your 3 major coronary arteries. So let us know in the comments if you're on here what you're diagnosed with, or please resubmit the question so I can answer it for you guys. Next question up tonight. What's the most effective pro-nitric oxide supplement on the market? Exercise, green leafy vegetables, and sunlight exposure. Do it the way that Mother Nature intended it. If you cannot find a reversible cause, there are oral dissolving nitric oxide lozenges that Dr. Nathan Bryan produces. And then Calroy has a product that is a capsule. ApoB of 87, LDL particle 1,333, 43-year-old healthy weight, how to reduce with lifestyle. It's going to be a little bit more difficult. The two biggest things that affect lipoproteins when it's lifestyle related is a poor lifestyle, unhealthy people who are eating, high saturated fat meals, having issues with insulin resistance, prediabetes. Then changing up your diet may have an effect. But most people's lipoproteins is under heavy genetic control. So ApoB is not a disease, it's a risk factor. So when somebody says that they're at a healthy weight, that's good. But do you have healthy arteries? There's lots of people with, no morbid obesity that have severe atherosclerosis. And I've seen patients in their 30s with severe coronary disease already requiring stents. So no telling just by your weight if your arteries are healthy. So if you have a normal carotid intermedial thickness scan, a normal calcium score test, normal CT angiogram if you've had that, then maybe you do continue to work with lifestyle interventions. But if you have plaque, then you want to use more aggressive therapies and generally target an ApoB under 70 and an LDL particle under 1,000. The lifestyle interventions are mostly to affect blood pressure, reduce the risk of dementia, which are good goals as well, but they don't generally have good effects on the lipids. Total cholesterol is 250 and LDL is 170. What do I recommend? First, have a particle testing done. So you need to know what your LDL particle is and your ApoB. That is it more risk assessing than just your lipids by a total cholesterol and an LDL cholesterol. Particles predict risk. So the cholesterol is just being transported in the lipoprotein. So you got to measure how many lipoproteins you have. That's what I would start with. And then, much to piggyback on the previous answer, is cholesterol is not a disease, it's a risk factor. So do you have plaque in your arteries? If so, then you may want to address lowering your lipoproteins with nutraceutical or pharmaceutical intervention. Should you get a repeat CAC score done? If so, how long after the first scan? Good question. So the CT coronary calcium score test is best thought of as a test that puts people into low risk or higher risk buckets. If your calcium score is over 0, you probably don't ever need to repeat it again. Start treating the risk factors that are driving the atherosclerosis. If your calcium score test is going to be repeated and it's already been positive, then you wait at least 1 year. Generally, if you don't do any intervention, the calcium score test may increase up to 20% a year. If you optimize nitric oxide, keep oxidative stress and inflammation low, treat the lipoproteins, generally do an ApoB of 60, then the calcium score test may not increase over that year period, or it only increases minimally, like 5%. If your calcium score is 0, then generally we repeat it in 3 years' time to confirm that it's still 0 at that point. Next question, how important is deuterium-depleted water for cardiovascular disease? How far down the rabbit hole do you want to go? Where can you find it? It's on Amazon, but you need to know what you're doing with it. You need to know the concentration, how much to drink, and then it's really just a risk-benefit. Can it be beneficial? Yes. Is it pricey? Can be. It's generally $7 to $10 per bottle, and you gotta drink a couple bottles per day. And then how long? Potentially lifelong. So really depends on how sick you are with cardiovascular disease. Is this something somebody should consider? But it's mainly for people who have really low redox and poor mitochondrial function and have tried everything else to optimize mitochondrial function, including they've optimized their circadian rhythms, they're sleeping well, they're using sauna, they're using cold plunging, they're doing everything they can to optimize mitochondrial function, and they're still not improving. Then DDW may be useful in some individuals. Next question. Somebody says they just started Leqvio, which is Leqvio. It's a PCSK9 inhibitor. What supplements would be good to take as a support? It's a targeted monoclonal antibody, so there's really minimal, if any, side effects for this medication. So there's no off-target depletions in minerals or nutrients that I'm aware of. So I usually break things down into 3 buckets. Is there something affecting nitric oxide? Is there something causing oxidative stress and inflammation? And then the 3rd bucket is treating the lipoproteins. So it sounds like you probably have the lipoproteins dialed in. Then do blood work to figure out if you have high CRP, high LP-like activity, high myeloperoxidase, high oxidized LDL. And then look at nitric oxide pathways, uric acid, homocysteine. You can just check your blood pressure if it's normal. You may have good nitric oxide pathways. So no particular supplement that you need to take due to a side effect from Leqvio, but there may be other supplements that support vascular health that you may be considering. Would having Raynaud's impact the accuracy of this test? I suspect you're asking about the endopat test that I had done as the picture in the story. I had an endopat done to myself last week. Mostly as just getting a baseline, was doing a kind of a biohack experiment to see what the results would be with it. Raynaud's potentially would definitely impact the test. If you have vasoconstriction in your blood vessels and finger, you may not get a good peripheral arterial tone on the test, but you can actually use the endopat test to diagnose Raynaud's. But most people already know if they have it. All right. So blood pressure has been controlled, but they've had a lot of muscle twitching and muscle cramps. Is this something they should be concerned about? Potentially. I don't know what would be causing this. Again, this is not medical advice. I'm not your physician, on Instagram, unless I actually am your physician at Apollo Cardiology. Blood pressure is, one of the risk factors for vascular disease, but what would be causing muscle twitching, electrolyte imbalances, thyroid dysfunction, a neurological nerve conduction study might get to the root cause of it. But if it's persisting, they may need a neurologist to further work that up. Am I happy with my Relaxana? Yes, I just set it up today. It's nice that you can break it down for the summertime. Any concerns with VOC off gassing in the synthetic fibers when it heats? No, but you're always worried about anything that heats up. But this was made by a reputable company. I don't have a way to test if there's off gassing from the device, but it doesn't, to my knowledge, or smell like a new car type of smell, where you definitely smell the off gases of the materials. If people are really concerned, then just use a hot bath. No off gassing. If you just want to get infrared light. And then somebody says alternative portable sauna recommendations. Sauna box brand. Not familiar with that particular brand, but again, you're going to want to look at what wavelengths of light, basically heat, are coming off the device. Is it near, mid, far infrared? Is it all three? Where is the source of the EMF coming from? Is it something that can be pushed far away from your central organs, particularly your heart and brain? With a Relaxana, the EMFs are at your feet, and you can get out of that position just by moving your feet. Are all the foods which contain nitrates good for heart health? Not necessarily. Nitrates are generally in the green leafy vegetables like spinach, arugula, kale. It's also in beets. But I think the next question was an add-on question to it, was about, what about nitrates in bacon? While bacon may be delicious, the nitrates are mostly from celery juice. They're not, intrinsic to the pork itself. It's part of the curing process. So it depends on how the bacon is processed. How do you cook it? Are there rancid oils? There's other problems with bacon in some individuals, but it's not the nitrates per se that's going to be the problem. So generally get the nitrates through one ingredient type foods. All right. So that was the pre-submitted questions. Thank you guys. Great as always. Every Monday, 6 p.m. Central Time, we answer these questions. Monday morning, I open a story, put the Q&A box. So that's the questions that go first. And then if there's time, which there usually is, I'll answer any questions that pop up in the comment sections. So question, can a heart arrhythmia be improved naturally? The answer is yes. How? Depends. Depends on what's causing the heart arrhythmia. Is it a atrial or ventricular arrhythmia? And then figure out what is the root cause and generally remove that etiology. But one of the most common reasons why I see them is, people with low omega-3 status because they don't eat seafood, they have a magnesium deficiency, they're living in a high EMF environment, they don't sleep well, they're abusing, stimulants, caffeine, nicotine. So figure out if there's a driver and remove it. But if not, then do biomarkers to figure out what you can do to support the body. Any thoughts on hibiscus tea for blood pressure? May help. I haven't seen significant data that it's that potent. All right, guys. So not seeing any other questions come in tonight. The archive will be live in a moment. These videos are sent over to my YouTube channel, which is drtwyman.tv. I'm playing around with a bunch of AI tools, and the best one I like right now is using the ChatGPT browser to do summaries. So the ChatGPT will summarize all the questions. It will have a kind of Q&A type of style in the description. And so if you're looking for previous archives for the past year or so, the YouTube channel will have it then. So hope you guys have a great evening. This is my favorite time Monday nights is to answer your questions, because these are the questions my patients ask me at Apollo Cardiology. And so it helps me prep for them, but I also like to, give back to the world that, I know not everybody's coming to St. Louis to work with me. I'm still open to that if people are interested in that. I'm booking out many months in the future. So if you're really interested, make sure you get your application in sooner than later, because at some point, and I don't know when, I will close the practice down to new patients and will only take care of the people I'm currently working with. So the only way to work with me otherwise is just going to be able to ask me questions through Instagram or join my Skool community. So again, hope you guys have a great evening. I'll see you next Monday, 6 p.m. Central Time.